This is a fantastic question. Why is it a problem to leave your geographic area to have surgery? So medical tourism is a problem all over the world. It's a problem within the United States even, and it can be very difficult as a patient to receive proper care if you do this, and this is why. So as a surgeon, this is a typical kind of cycle of life with my patients and I. So they meet me for a consult. They will come in several weeks before surgery and we'll have a preoperative appointment. That appointment, we talk about all the risk and benefit and make sure that they're ready for surgery. Several weeks later, they have the actual procedure. My patients are seen the next day by one of my staff, usually my nurse practitioner, to check on them. They see me in follow-up, usually at 1 week, 1 month, 3 months, and 6 months. And then, of course, more appointments if they need. Part of getting a good surgical outcome from an aesthetic standpoint, but also a safety standpoint, is all of these follow-ups and being able to see my patient and intervene when needed when I see complications or something potentially not healing as it should. So complications after surgical procedures don't happen right away often. They can happen several weeks later, especially with plastic surgery procedures. There's all kinds of problems that we can see. Infections, seromas, things that are scarring strangely, all kinds of problems that can affect you from a safety standpoint, but also from an aesthetic outcome standpoint. Now, when you pay for surgery, your aftercare is included in the price. So we do something called a global fee. So your global covers the procedure and then some period of post-op care. So for cosmetic procedures, most of us have a much longer period of post-op care that's covered compared to like an insurance-covered procedure like a breast reduction. So most plastic surgeons that I know cover all of your post-op visits for 6 to 12 months. Free of cost. So you can come in and see me in follow-up, and we encourage that because that's what leads to good outcomes. We want you to look great because not only do you look great and you're happy, but it makes us look good too. So say you fly out of the country and you have surgery. You don't have that ability. Majority of people that are choosing to fly out of the country for plastic surgery are doing it for cost reasons. They're doing it because it's very inexpensive, which also makes flying there for multiple post-op visits difficult because it's expensive. And it's important to remember that a lot of times when you have complications, especially when they're serious, you don't have the luxury of time to plan a trip, go to the airport, fly down there, go to visit your surgeon, that you need to be seen right away. And so these patients end up in an emergency room. Now, since a lot of these patients aren't following up with their surgeons the way they would if they were in the geographic location, issues they're having tend to get worse because they're not being seen early. And so we see a lot worse problems with our medical tourism patients because they're not getting the proper follow-up care. Now, can you have surgery out of the country and have another surgeon take care of you for your post-op care and just pay them? Sure, but it's hard to find a surgeon that wants to do that. We don't like taking care of other people's surgical patients. I don't know what that guy did. I don't want to take on the care of his patient. You paid that person, they should be caring for you. That's part of the deal. And it's very difficult to find a surgeon to care for you if you're having problems after surgery with another surgeon. So all of these things together make it more complicated to get proper care after surgery. Now, if you're in the United States, so say you have surgery with me, but you actually live in New York, the infrastructure in the United States is something that you know, your insurance covers it. I have friends all over the country. If you're in New York and have a seroma, I'll call one of my friends and we can get you cared for. We have the infrastructure and the relationships here in our medical community to take care for you, but it's still a risk if you do it in the United States. It's an even bigger risk if you go out of the country. So that's why you see a lot of surgeons bringing it up. It's people are like, oh, they're taking your business. No, they're not. I'm doing just fine. I'm trying to help patients because I don't like seeing people with horrible complications. I cannot tell you how many times a week I get consult requests from people who have horrible outcomes because they went somewhere with a doctor they didn't vet, or they had surgery somewhere and the surgeon's not available, not even answering the phone when they call for help. I see it all the time, and it's horrible, and I don't want people to suffer those problems. So I'm just trying to give people the tools to make good decisions. If you decide to go out of the country, that's totally fine, but you should be smart about it. You should make sure that you understand the system, you ask all the right questions, and you have access to care afterwards. And this is a discussion you should have with your surgeon. If I have trouble, what can I do? How can I get care? How are you going to help me? And you deserve those answers.